today's webinar is prospective and predictive audits. Really a 2025 strategy you can't afford to skip. This is going to be very much based on what we see happening in the MD audit community. We're going to talk about the MD audit community in a moment, but things that are being employed to really recognize compliant billing, but also the maximizing revenues and really leading to healthier bottom lines. And again, we thank you for joining. My name is Dana Finnegan. I am the Director of Market Strategy at MD Audit. I've been here about 8 years, so really cognizant and immersed in what's going on in our ecosystem, whether that's billing compliance, or revenue integrity or coding and HIM. All of those different constituencies can really, I think, benefit from what we're going to talk about today. I do want to mention who is hosting this webinar. It is MD Audit. Little bit about MD Audit is we are a platform, a SaaS-based platform that has been in this space for over 30 years. We're almost across all 50 states, nationwide footprint. And you can just see some of the numbers here. And the reason why I'm kind of showing this and letting you kind of read through some of those numbers is we just want to really hammer home that we've been in this space for a long time and we really understand what's going on, really what your pain points are, and how to solve some of them, or most of them. And we're also going to talk about some data, some really important data that's coming out of that MD audit community. But I would say, again, we are in almost 50 states, serving over 700,000 providers, and really understand the goings on in billing compliance and revenue integrity. Also mention here, I think it's a good opportunity to say that, as a vendor, we're not here today to really sell you anything. Honestly, we're just here to expose what we see happening, not only to serve those in our MD audit community, but others that are not part of that and may want to be at some point. Couple of housekeeping items before we get into this is you will be receiving this deck. You will be receiving the recording as well. At the end, if you would like, there is going to be a quick survey just asking you some other topics you may want us to present on going forward. Anything else, any feedback you want to give is appreciated as well. And I would also say if there are any questions, please put them in the chat and we'll refer to those at the end if there is time. I'm hoping there will be. And finally, when I say you'll be getting the deck, I think that's important because we want to send you away with some important nuggets of things that you can use to operationalize back in your billing compliance and revenue integrity programs. And you'll see that in a moment. So I think where we want to start and why we're talking about prospective audits and predictive approaches is we really feel like the perfect storm is here. And it's not meant to be a scare tactic by any means. It's just, by meeting with clients every day in and out, we hear the same things. And the first one is that government and commercial payers are really doubling down on denials, not only denials, but their external audits. When they're sending you those ADRs or they're looking to do those clawbacks, that can even be DRG downgrades, whatever it may be, they're doubling down on the denials in their scrutiny. The second one that we're hearing is that, or that we know it's been going on for some time now, is that payers are heavily investing in AI models that are causing historical denial rates. And what's interesting is I think we've all been in the business long enough to know that we always felt like those authorization and pre-cert denials would always be, that number one reason for denial. We now see, based on those AI models that they are instituting, that it's really starting to be surpassed by coding-related denials in those coding-related categories. So, and we'll talk a little bit more about that in a moment, but really interesting stuff when you start to see denials in different categories outpacing those very standard eligibility and pre-cert and authorization denials. The third thing that I think is most interesting, and a lot of you will probably shake your head and say, we're feeling the same thing, is I recently sat at a CFO roundtable at HFMA in Denver a few months back, and really what we were trying to say, or what they were trying to say, the CFOs and everyone working in the healthcare organizations, was they are investing in AI, But they said as soon as they train their AI models to really kind of get in pace with the payers, they said immediately the payers then retrain their AI models. They get more sophisticated, and those denials just happen over and over. So it's almost like this cat and mouse game where they're both kind of chasing each other in kind of a circle, but we always hear the payers are a little bit ahead with those AI models. Again, therefore, with why we see those denials and in huge increases in external payer audits. So we're going to talk a little bit today about how you can kind of get more in the driver's seat with that in mind. We're not going to go through this article, but I would, you'll be getting this deck. I suggest you read through it. It's really, really interesting because not only are we seeing these increase in denials and payer audits within the MDaudit community, but this article here just speaks how it is just nationwide. Everyone, getting hit hard, whether you're a long-term care facility, a SNF, whatever you are, you're feeling the effects of this. Just a couple of, this is why I talked about the MDaudit community, is in this, we can look at the pictorial down below, but what we saw in 2023 and 2024 was just a 5 times increase in payer audits. So you'll be getting this to kind of take a look at this and dig in, but you can see here in 2023, it represented about $2.6 million that were at risk revenue from clawbacks and takebacks. Now you can see that in 2024, and we have not yet calculated 2025, we're doing that as we speak, and we'll share that with you. We already see an increase over 2024, but you can see in 2024, that went up significantly to 11.2 million. And that's coming from that alphabet soup of, RAC, MAC, SMRC, UPIC, commercial payers, and so on. And I think that the more harrowing part of that statistic that we see is the fact that a lot of these payers are moving from a post-payment payer audit to prepayment. So it's really kind of throwing people into a tizzy, needing to get that documentation available, those medical records available to really fight this surge. So again, we're going to talk about how we fight this surge, things we can employ to make this better. It'll never completely go away, but what can we do to make it better? But you're probably feeling this crunch as well, just an unprecedented amount of payer audits from both government and commercial payers. I think the other piece that we talked about, along with payer audits being part of that perfect storm, is the unprecedented denial activity. And again, this is coming from an MDaudit community benchmark report. This isn't a survey. This is real data from what we're seeing in our community. And the scary part is the average denial amount increased from 2023 to 2024 about 126%. Many of these being in that coding related category. Other things like information needed, documentation needed, and that very vague reason where the payer will say claim is missing information or has submission errors. So not only are you getting denied at historic rates, but a lot of those denial reasons are vague and kind of leave us scratching our heads on what they are looking for, what information, what documentation, what's the submission error. So 126% increase 2023 over 2024. But the more interesting piece is if you look at it broken down by pro fee, outpatient, and inpatient, 219% increase from 2023 to 2024 in the inpatient side of the world, which is quite scary because that's where you have those huge lengths of stay, very acute sick patients where there's a lot of revenue in reimbursement at stake. So lots of denials there. And we see folks eventually getting paid, but that's only after a multitude of efforts and rework that really erodes the actual reimbursement that you're getting back because of the number of dollars you're throwing at those appeal activities. So again, perfect storm, payer audits, unprecedented denial activity, particularly in the coding related category. And then when we talk about denials, it's not something that you can easily glean. It's information needed, documentation, things that we don't know exactly what the payer is looking for. So we talk about a strategy. And again, we have a lot of MD audit clients on the call right now. We have a bunch that aren't part of our community, but we're going to talk about a strategy that MD audit really holds near and dear. It's supported by MD audit data. It's driving positive outcomes. And one of the things that I thought about before this session was I think people are going to say, hey, this is pretty basic, but when we think about it, we don't see it always being employed. A lot of times people get too busy, they can't do certain things, or they can't operationalize certain things that are really important to fighting that storm. So I'm going to go through this really quick. But on the left-hand side, we're going to talk really about how billing compliance can be prospective, but how revenue integrity can be predictive in both of their worlds. So in billing compliance, the first thing we want to talk about is you have to employ a blend of prospective and retrospective audits. Most of you are doing that right now, but you're going to see that if you're not starting to shift towards a much higher percentage of prospective audits, the denial and external payer audit activity is going to kind of become overwhelming. Now, we're not just saying to shift towards prospective audits, put everything on hold. You can't do that. You have to be practical at what you're going to hold up and prospectively audit. That's why we want you to not only use prospective audits, but analytics, AI, and benchmarking to really unearth where the at-risk population is. Your at-risk providers for overcoding and undercoding, your at-risk billing patterns, and so on. So you have a very targeted approach at what you're going to hold up and audit prospectively. So that's really the billing compliance world. On the revenue integrity side, we really want folks to start adopting a pre-bill predictive approach, meaning employ technologies that have the ability to interrogate pre-bill charges and tell you this is most likely to deny, also give suggestions on how to fix it, and really bump that up versus payer adjudication policies. If you can have that trio of things going on, you're going to be able to fight a very large amount of what you're getting denied and essentially what's going to show up at your back door via an ADR or a clawback. When we've seen our revenue integrity people use certain technologies to do that predictive approach, we're seeing much higher first pass pay rates, less days in AR, and healthier margins. At the end of the day, we're going to show you how you can do both of these with a quick demonstration. But it's not a silver bullet. You're still going to get your denials. You're still going to get your payer audits. But the goal is to mitigate it significantly. And again, we see this happening in the MD audit community when both billing compliance and revenue integrity are employing certain technologies to do this. And we'll show you this in action in a moment. I do want to talk about just a couple of things here supported by the MD audit data. We'll go through this really quick, but when the appropriate, you can see audit productivity soaring via technology. So when you can partner with a responsible vendor that has the ability to master data ingestion, like your claims and your remits and other clinical data, all and make it consumable for you. You can see that over 2023 to 2024, we saw a 35% increase overall in the number of audits that auditors were able to get through. And that's on the pro fee side. That's the facility inpatient and outpatient side. There is technology that can help auditors not worry about data ingestion, not manipulating data, just getting you the sample sizes you need immediately so you can go in and employ those prospective audits that we're going to talk about in a moment. The bigger number here is prospective audits. It's what we talked about before. If you're not starting to have your compliance program move to a much higher percentage of those prospective audits, there's going to be a lot more overwhelming issues coming at your back door. So what we did see here through our technology is year over year, again, 2023 to 2024, is there was a kind of a small increase, as you can see, for retrospective audits overall, but a 275% increase in prospective audits. Really what it told us was there is change management involved in employing this prospective approach, but it is well worth it when you see the statistics in the long run. It is a joint effort between compliance and revenue cycle to understand, what we're going to hold up, how long we're going to hold it up. There's a whole change management piece there that, we can help you understand best practices, but that increase directly speaks to folks in our community that know this has to be done on a prospective basis to really stay alive in today's payer ecosystem. So big increase there. What I wanted to do, we're not going to go through this right now, but my take whenever we ask folks to kind of join a webinar, even if it's for a half an hour, is we want to send you home with certain things that you can go and take a look at it in your program. So what I did here, and I'll be sending this out to you, is I've highlighted the top 15 codes on the professional side that are being prospectively audited. So you'll be able to take this list and kind of compare to these the ones that we are prospectively auditing. And the reason why these are being prospectively audited, it's not a willy-nilly approach by our community. These are the ones that are, again, recognizing the highest amount of denials and the highest amount of payer audits and clawback. So we've got those listed from first to last, so you can take a look at those on the PV side. Just as a quick FYI, we've also got that bulleted out for you on the outpatient side. A lot of radiology codes I see here at the beginning. Again, we're going to give this to you. You take it back. You start to compare this to what you're doing prospectively. And then, of course, on the inpatient side, and that number one that's far outpacing all the others is sepsis. I don't think any of us are surprised by that. But again, our view is if you're going to take your time to sit with us today, we're going to give you something that you're going to be able to take back some small nuggets to really help with your prospective audits. So the reason why we started talking about data for those prospective audits and seeing that really rise so much is it's just a means to an end that you have to really go with. We're expecting now to go from a 50-50 retrospective prospective approach to now an 80-20 with prospective being 80% of the game. So just again, take a look at what you're doing for your program, and if there's any advice you need or anything you'd like to kind of hash out, let us know. Where I won't, we weren't going to go through this as well, but I suggest that you read it, is an article that came out from Becker's, and this was just very recently, was what separates high and low performing hospitals in 2025. When we talk about high and low performing, we're talking about hospitals that have, decent volume of ASC activity, inpatient activity, all of that. But what are they doing to stay in pace with that perfect storm? Now, any vendor is going to tell you invest in technology because they want to sell something to you. But this is Becker's. This is kind of a obviously a very legit organization. And in a couple of their top 10 things was, and right in the middle was investing in technology. It was really a lot of really good insights as to if you invest in the right technology, the right vendors, they can help you do these prospective audits and these predictive approaches so you're not drowning in those denials and payer audits. And that third part, where that aggressive payer strategy just says, if you are employing the right technologies, you don't have to be sheepish when you go into your negotiations with payers. The data you're going to be able to glean from a vendor showing you what was paid right, what was paid wrong, when did the payer take too long to pay based on their service agreements. A lot of great stuff you and payer relations can bring to the table to have a seat at that table and be more aggressive in negotiating rates and just better outcomes. So just wanted you to have an insight into that as well. What I'm going to do right now, really quickly, in about 7 minutes, is a quick demonstration just to show you really how easy it can be when you're partnering with the right vendor to first take a prospective auditing approach using analytics and benchmarking. And then we're going to show a little scenario for billing compliance and revenue cycle and how they can be predictive and understand via payer policy access what's going to deny and really how to make it not deny on a pre-bill approach. So one of the things I'm going to do here really quickly is just show you that, prospective audits, this is showing how MDaudit can take really every one of your physicians that in this case is billing E&Ms. We can do this for procedures, DRGs, the whole gamut. But if you're asked to go and really prospectively audit all of your physicians, it's not feasible. You really want to be able to audit the physicians that are posing the highest risks of overpayments and underpayments. So you're going to see here, we first have thousands of physicians represented by bubbles. The physicians in the middle are the ones that are their E&M levels are appropriate. We want to kind of expose the lower left where there's habitual undercoding going on, maybe some loss of revenue, and the upper right where there could be habitual overcoding going on and in risk of clawbacks, takebacks, even those pesky comparative billing reports you get. So how can technology and benchmarking and all of that help you focus on the lower left and the upper right? Well, really quickly, MDaudit allows you, and I'm saying MDaudit, but any good vendor would be able to help you with this, and we hope you would consider MDaudit. But you can compare your providers to CMS, what they consider normal E&M leveling patterns by specialty. That's a really great benchmark. You can also, one of the great things about being part of our community is you can compare your providers to the MDaudit community. So all of the other providers that are being audited on our platform by specialty, because you want to really be able to toggle between both of those to see where your risk is. So I'm going to set a benchmark there. I'm then going to put in an E&M category. They'd all be in here. Let's just make it simple and say established patient. We're then going to go in and choose a specialty. We're going to put in, let's do internal medicine. You see the bubbles start to shift. Now I'm going to go in and put even a more granular specialty. I could do cardio, I could do nephrology, hematology, oncology, I'll do gastroenterology. And what you've seen now is the ability for you to take your providers and say, okay, for my gastroenterology department, I'm not going to do any prospective audits here because these were the providers that were removed from the middle. Their E&M leveling patterns are appropriate in most cases. I want to concentrate on this provider and in that provider. This is an undercoding physician, and that's an overcoding physician. Now I can click on this bubble and also see that bell curve. We won't go through this in detail because we're going to show you the prospective auditing piece. But this line here is the physician that MDaudit found at risk because almost 100% of their established patients are going out as this level 3. Very little 4s, almost no 5s. This yellow line represents everybody else in that provider's department. So that's an internal benchmark saying everybody else practicing in that same department is only doing that 54% of the time. And this benchmark that you see in the back is MDaudit. It's MDaudit gastroenterologists are only doing that 44% of the time. So everybody else at your organization, much more in alignment with the norm than this provider. And really, he or she needs to be audited prospectively going forward to make sure that these overbilling or whatever the case may be, underbilling stops. You can stop it before it goes out, fix it, and then, of course, educate the physician as well on what you're doing. And there's a very easy way to do that. Now, this is a visual, but I want to show you that just how easy it can be to do a prospective audit. So I'm going to put in Dr. Smith is who we're going to prospectively audit. I'm just going to put a couple of variables in here. I'm going to assign it to myself, Dana, but I'm going to hit continue. And all I have to do a prospective audit is go in and say, this is a professional claim type. You can also do this on the hospital side, but let's go in and say that provider's rendering NPI that is doing that habitual overcoding or undercoding is this. When I hit these arrows, this is going to fill up with a number, but what it's doing in reality is interrogating your billing system and pulling out pre-bill charges. This can be done with Epic, Cerner, IDX, any billing system. You can see that immediately reaches in and pulls out 1,832 pre-bill charges from, call it an Epic work queue or a suspense mechanism, whatever type of EMR you're using, we can suck that in. It's going to show you there's 1,800 of those charges, pre-bill charges. You can very easily put in a sample size of 10 or 20 or 30, whatever you want. That's going to be statistically significant. It is going to be random. And once you hit continue and create the audit, the system's going to spin and put those pre-bill charges in front of you So you can go in and do an audit, go in and figure out why is that physician overcoding or undercoding those levels. And again, this can apply to coders that are coding. This can apply to bringing in high-risk DRGs or APR DRGs, whatever you want. But the point is I can now have easy access to these claims and start that review. Um, Now, we won't get into this today because we don't have time, but it gives you immediate access to these claims so you can go in and do your coding quality review. So, our first approach for billing compliance is use analytics, benchmarking, AI, other things. So you're not, starting off with 1,000 bubbles, but you're really going in and hitting those high risk areas and not working so much in the middle. Prospective audits, if you're going to employ them, has to be done from risk-based analytics. Now, really quickly, just because I see that we're almost at time, is that was a prospective auditing that can be employed by billing compliance. What can revenue integrity do? And I just want to give a quick show of what we can help with revenue integrity. Now, we really feel like a secret sauce for folks trying to fight denials on a predictive basis is to have access to payer policy. So we're not going to do this now, but I ran about 800 claims, pre-billed charges rather, have been finally coded, and are just kind of sitting there in a queue. And I'm not going to go through this, but a bunch of different rules and algorithms can be invoked on a predictive basis to help you understand things that are, again, going to deny, how to fix them, and what you need to do. So I'm going to look at this one right here where there's $45,000 every time there was an insertion of a leadless pacemaker. We kept on getting denied for this over and over. It was being billed out of a multitude of facilities. There was millions of dollars at risk. And there kept on being a very pesky denial. Those ones we talked about before about info needed, documentation needed, submission error. That tells me absolutely nothing. I think I've submitted a clean claim. Clean claim. The end result that we want folks to see is you want to also be able to access the policy. You need that policy, and you don't need a policy that's 5,000 pages, which many of them are. You need a policy that when you click on it, like I'm going to do right now, is going to bring you to the page of that policy that tells you what indeed is that missing information. Now, I can tell a quick story here. We worked with our client. They saw that they were submitting the condition code 30, this diagnosis code, and the appropriate modifier. But for this particular manufacturer of this pacemaker, they had to report in Form Locator 39, obviously on the ANSI standard claim format, the device number. So they ended up billing an edit in their system. I believe it was a Cerner system, where they were able to capture all of these pacemakers and put on that device number in the appropriate place. So going forward, all of these were paid on a first pass. It ended up being millions of dollars in savings. But really what I'd want you to see from this is there is technology out there that can scrub those payer policies and let you know what that missing information is. So really, in conclusion, folks, and I'm more used to doing hour-long, so I may be up against time here. What we want you to take away from this is the fact that, and we're going to go back to this one slide, you'll be getting this deck, is if billing compliance and revenue integrity, we have seen in the MDaudit community when this type of approach and technology is being employed, much, much better financial outcomes. Again, the goal is to be predictive, but always ability to pivot to those payer requests and denials as well. Hopefully this was helpful, folks. You're going to get this deck shortly in the recording. And again, if there's any questions that come up, please contact us. Happy to help with best practices and any advice you may need.